Good evening, everyone. Welcome to OET Listening Pro S, and this is Divya Benny from 𝐒𝐄𝐲 Academy. How are you guys? We are back after 1 week, and yes, today I've come up with part B of OET listening. Last week we had a session on part A of OET listening. How is your preparations going so far? I hope you were able to practice so far. So yes, as I just discussed earlier, we will be going for part B of OET listening. Let me just give you an idea regarding what exactly you can expect in part B. I'm aware that you do have a awareness regarding part B, right? So as you know, part B will be having 6 questions, right? You can expect 6 questions for part B, and each question you can expect 45 seconds of audio, and for each question you will be able to get 15 seconds to read your entire question, and after each question you'll get a 5 seconds to come up with the answer of the same. Okay, so I can understand, see, part B is something which is going to be much more easy for you to gather informations or to get the right answers. So what can we do for part B? What are the informations that you usually do? Meanwhile, I'll just wait for others to join and we'll be continuing afterwards. So as I already mentioned, for part B, ensure that you're reading your questions very thoroughly, twice at least, so that you'll get an idea regarding how things are working. It can definitely help you. Now, apart from that, for each question, as I already mentioned, you will be able to get the context statement as well as the gist, so that will be helping you to reach your answer. Okay, so without any further delay, let's start. Hi Vinny, good evening. So yes, the question will be displayed on the screen for you now. Okay, and then we'll start right away. Yes, I hope the question is clear for you. So this is a set of questions that we will be discussing today. So yes, hi Jessa, good evening. How are you? I hope you're doing good. Yes. Okay. I've mentioned earlier as well, when you get your instruction, you ensure that you're reading your question rather than utilizing that particular time to listen to that particular instructions, because you'll be getting another 5 to 10 seconds for the same. Hi Megha, good evening. Hi Asha, good evening. Yes, so we just started. So here you can see in this part of the test, you will be hearing 6 different extracts, and each extract you'll hear people talking in a different healthcare setting. For question 25 to 30, you can choose the answer. As you know, we'll have multiple choice questions over here. For each question, you can get the 3 options to come up with the answer. Okay, so let's start with our first question. So that's our first question. You hear a patient talking to a dental receptionist, and how does he feel? And we have 3 options here. Worried that he may have damaged a fill-in, disappointed that he can't be seen immediately, nervous about being treated by the dentist. I know most of the time what happens is that you might reread your options maybe once, twice, thrice, and what happened, you might end up with the first option that you're listening to while you listen to the audio. Come up with the first option that you just listen. No, it's not like that. First of all, focus on your question. So here, this is your context statement, or what we can say, the gist that is mentioned over here. So here you can understand that's a conversation which is happening between 2 people. There is the patient, and we can understand there is a dental receptionist. So you have the context, and you do have an idea regarding the setting where the conversation is taking place, right? It's a dental receptionist, so which means the patient is about to meet the dentist, right? So what is the question here? Can you tell me what is the question over here? Which one do you think is the question here? Among these options, which one do you think the question is, how does he feel, right? So tell me, what is the keyword that you're planning to mark over here? Do comment the same. I would like to know. Okay. So when you get the question, ensure to get a clear picture about each word rather than getting a word by word meaning. I would say try to understand what collectively a particular sentence is actually happen to be. So here the question is, how does he feel? So can you tell me the keywords that you're focusing over here, or which is the keyword that you will be mentioning here? Which is the keyword? Yes, Megha, feel. Yes, that is your question. Okay. Yes. That is your question. Do not deviate from your question. The previous statement, this is a stem, or what we can say a context statement. You are getting an idea that the patient is talking to the dental receptionist. Yes, Jissa, patient feel. So the focus is, how does he feel? So this is again, you can understand there is a he over here. Now each option is worried that he may have damaged a fill-in. So the patient might be worried whether they have damaged a fill-in. That is a one answer. Disappointed that he can't be seen immediately, which means yes, Roshna, good evening. Asha, yes, you're right. Patient and feel. So the second option is stating disappointed. He's pretty much disappointed that he can't be seen immediately. Maybe the doctor. Nervous about being treated by the dentist. So that is showing his worry towards being treated by the dentist, right? That's what it is happening over here. So you have to understand the intention, or what is the main point of discussion which is happening here. So what you can focus on the tone of the voice that they are focusing, choice of the words that they are including, and look out for any expressions or any concerns or even any frustration that they are trying to explain over here. Okay. And see, suppose if the patient is explaining any past experience or any problem, that could actually indicate how he is actually feeling over here. Okay. So focus on what they are trying to convey over here, so that it will be much more easy for you. Okay, while you listen to the audio, you can actually try to eliminate if there is any particular option that you don't find. And remember, you can expect paraphrased sentences over here, so you have to always be ready for the same. And only come to a conclusion after reading or listening to the entire extract. Okay, you'll get another 5 seconds after each small extract. That means after the 25th question, after they are done with the option C, or after they are explaining all the information regarding the 25th question, then you will get another 5 seconds. During that time period, you can try to use that particular time period for coming or taking any particular conclusion of the answer. Okay, do not jump. I'm again stressing about the same. Do not come to any conclusion without listening to the entire audio. Okay, as I already mentioned, there can be distractors over here. You have to find out which is going to be the relevant and which is not going to be relevant. Okay, so ensure that you're focusing on your question. Try to understand the meaning of the question, and while you listen or while you understand the scenario, you can try to imagine what type of language or what type of conversation you can expect. So that will be giving you an idea or giving you a picture regarding the type of informations over here. Okay. Yes. Now let's move forward to the next question. So you hear a part of presentation to nursing staff about an existing visiting hours. So this is a presentation which is happening to nursing staff, and it's about an existing visiting hours. So you do have an idea regarding what is actually going to be the conversation over here, right? What are they planning to ask in this particular question? So what is the speaker doing? That is your question. Now tell me, what is the keyword that you're planning to include over here? Do comment the same. What is the keyword that you're planning to include over here? You can understand the question over here. You have 3 options over here. So you do have an idea that that's a presentation which is going to be happening, which means the particular person will be explaining things throughout. And the topic is also, you're getting an idea. Visiting hours. Yes, you're right, Megha. What is the speaker doing? So what will be your keyword on the question? Which one do you think? What is the speaker doing? Nursing staff. Okay. What will be your keyword for the question, not about the stem or the context. So here you can understand, here they are asking what is the speaker doing. So it is very clear regarding, they would like to know regarding what does speaker is trying to convey over here. And here we have three options. Detailing the benefits of the plan change. Speaker doing. Yes, Asha, speaker doing. So detailing of the explanation. Yes. Detailing the benefits of the plan change. So you might expect some information regarding the change in the plan and how that is benefit. Yes, Jissa, yes, Roshna, you're right. Speaker doing, you're right. Now, the second option is reassuring them that their workload won't increase. So basically, they are trying to convince them that the workload is not going to increase, which means they're not going to have more work. Now, next one is explaining steps that they should take to avoid problems. So they're going to give an idea regarding what type of steps they should be taking to avoid any sort of problems that they can expect. Okay. So now, what you can do over here, you can actually try to, pay attention to the verbs which include explaining, detailing, or even reassuring. So this will help you to get an idea regarding the conversation. So the speaker might be informing or even giving instructions regarding the particular topic. So ensure that you listen for the presentation for the aims that you should be trying to achieve over here. So your question is, what is actually speaker doing? So you would like to know regarding the entire context, right? What is the speaker trying to convey? You do have an idea regarding what is the topic over here and what you can expect in that particular conversation. That is why the context part is going to be helping you. Okay, I hope you're clear so far. Now let's move on to the next question. You hear surgeon discussing a patient with a nurse in the recovery ward. What is the surgeon concerned about? Okay, now tell me the keyword in this particular question. Make it fast, guys. What is the keyword that you are going to include over here in this question? Is there any particular keyword that you would like to add over here? You hear a surgeon. So you can understand there is two people in this conversation. There is a surgeon and there is a patient. And the setting can be recovery ward. Yes, just a surgeon is concerned. That is going to be your keyword. So basically the conversation is going to be about surgeon discussing with the nurse in the recovery ward, and what is the surgeon concerned about. So you might, yes, yeah, Asha, yes, Roshna, you're right, surgeon concerned. So you might hear to information that patient might be concerned about. Okay, here the question is very well evidently stating surgeon concerned about. You should be having an idea regarding what is the surgeon concerned about, not the patient. So you can expect distractors like that. Maybe you might be able to listen to the information which the patient is concerning about. So do not confuse about these things and come to any conclusion. Okay, now we have three options over here. Incomplete result from the lab test. So you might be able to you might, or the surgeon might be concerned about the result which is not complete, that is from the lab test. Possible post-operative side effects. So basically the side effects the patient can experience after the or during the recovery time period. Now the patient level of consciousness. The patient's level of consciousness can be mentioned over here. Okay, so surgeons can often, you can understand, often discuss about the potential complications, or you can say they might be discussing about any important, patient indicators which might be including the consciousness or about the lab results. So what you can do is try to look for any key medical concerns which is raised by the surgeon that seem to be the focus of the discussion. So you have to understand what is going to be the actual focus regarding the entire conversation. It's going to be very easy if you get a clear picture about the same, and if you are able to differentiate between each options, it can definitely help you to find out what is the conversation which is happening. Okay, I hope you are with me so far. Now let's move on to the next question. So your 28th question is, you hear a chiropractor briefing a colleague about a patient called Ryan. What is the overall aim of the treatment plan? Now tell me the keyword in this particular question. Make it fast, guys. What is the keyword? So the conversation is between a chiropractor who is briefing a colleague and the patient about the patient called Ryan. Okay. So you have three options over here as well. What is this keyword over here? Improving pain relief. So basically chiropractor might be briefing about the pain relief, or how the patient can get a relief from the pain, or maybe restoring feelings in the arms. Maybe they might be speaking about what the patient is actually feeling. Yes, Roshna, that's going to be aim, treatment plan. Yes, aim, treatment plan. Now the next one is overall aim. Yes, Chissa, overall aim. Now the next one is restoring feeling in his arms, and option C is treating the side effects of an operation. So these are the three options they've stated. So your question is, as the chiropractor is actually briefing the colleague about this patient, what is the overall aim of the treatment plan? So basically, what actually a treatment plan, or what if the patient is undergoing this particular treatment plan, what he or she can expect. That is the overall aim. Okay, so whether they are going to get a pain relief, or whether that will be helping to restore the feeling in his arms, or treating the side effects of an operation. That is what it is mentioned. Okay, so here, so usually the treatment should be focusing on improving the specific condition, maybe like pain relief, restoration, or any function. So you can try to understand which part of Ryan's condition is actually the persons, whoever is having a conversation, they are trying to prioritize. You have to understand regarding what they are trying to include over here. Okay, so you would like to get you can expect a paraphrased information, as I already mentioned. Get a clear picture regarding what they're trying to listen, or they're trying to continue. As see, this is going to be a natural accent conversation, so you might find that they are speaking a bit fast, right? The pace can be a bit fast, but that's okay. What you can do is you can listen to the total documentaries, so and so that you can keep up with the pace that they are going, because that's a recorded conversation of the workplace, actual workplace, how they usually communicate. So you should be having an idea regarding the same. So try to get used to the accents so that you won't find that difficult to get an idea regarding what actually they are trying to convey here. Okay. Yes. So now let's move to the next question. That is, you hear a surgeon talking to a group of medical students about patient risk in emergency surgery. And the stem or gist of the same is, so the surgeon is emphasizing the fact that. Okay, so you hear a surgeon talking to a group of medical students. So tell me the keyword. What is the actual keyword that you're planning to include over here? What is the actual keyword? So you can understand that's a surgeon who's going to be talking to a group of medical students, and the topic is about the patient risk in emergency surgery, or the risk the patient can experience in an emergency surgery. So tell me, what is the keyword over here from your question? Which is going to be the keyword? To comment the same. So we have three options over here. The prompt preparation is the most effective way to minimize patient risk. Next one is certain types of surgery carry more risk for patients than others. And third one is patient at higher risk require extra recovery time after surgery. Okay, so what is going to be your keyword over here first of all? Is there any particular keyword that you have noticed over here? Is there any particular keyword? You can understand they are telling that if they start with the preparation, that can be most effective way to avoid any or reduce any patient risk. Okay, now second one is certain type of surgery. So which means they're trying to say some type of surgery carry more risk for patient than others. Not so from that particular sentence, it is very evidently stating that not every other surgery is actually giving more risk for the patient than others. Okay, and patients at higher risk require extra recovery after the surgery. So they are telling a patient who are at a higher risk, they will require extra recovery time after the surgery. You didn't mention regarding the keyword over here. What is the keyword? Is there any particular keyword that you have noticed? Okay, I'll come up with a keyword then. So the surgeon is emphasizing, right? Here, the surgeon is actually emphasizing. So emphasizing means they're trying to give the importance. That is the another meaning. So who is actually trying to give the importance? The surgeon is actually trying to give the importance over here, right? See, the surgeon. So you can try to listen for what the surgeon is actually considering the most important factor in the risk management. You can expect that can be promptness, maybe that can be about the surgery type or even the recovery periods. So yes, just a surgeon and emphasizing, yes. The surgeon will likely stress the critical point through the tone and even the repetition. So you have to focus on what is the actual informations that they are actually going to include in this part of audio. Now, final question is, you hear a surgeon talking to a patient who just had a knee operation. So here the surgeon is talking to a patient. So that means a conversation is happening between the surgeon as well as the patient. Yes, Roshna, for the previous question, surgeon emphasizing and fact. Yes. So here, the patient, you can expect that this patient had a knee operation. They are having a conversation about the same. So the question is, man's comments reveal that he is. So what is the keyword? Reveal, comment. So what is the actual comment revealing over here? Determined to start doing as the sport as quickly as possible. So basically, the patient might be a person who is actually following the sports, or so that he is actually planning to start the sports as soon as possible. The next one is impressed by how little. This is little, okay? Little time is spent in the hospital. So maybe the patient might be surprised to listen that how little he was, or he just had a very short time period in the hospital. Now, surprised that he will be relatively pain-free. Yes, just a man's and reveal, yeah. Surprise. So here is actually very surprised that he is actually pain-free relatively so soon. So he's actually surprised about these things. So here you can, it's more like a reaction to the surgery, right? Maybe surprise at the pain relief. As they mentioned, it can be about a quick recovery. So understand this emotional response by paying attention to any sort of adjectives you can hear, or even expressions of surprise, gratitude, or even satisfaction. You have to find out what they are trying to say. So that's about the questions that we will be doing. So what you can do, please ensure that you are paying attention to the speaker's tone, whether they are concerned, whether they are actually focusing on any other particular information. You can try to use the elimination strategy to narrow down the answers, as we have 3 options over here, and look for the key phrases or phrases in the audio that is actually relating directly to your question. Okay, you should have an idea regarding the question. Yes, Asha has revealed. Yeah. Right, you're right. So ensure that you're focusing on these information so that you will have an idea regarding how to come up with the answer. Okay. So now I'll be playing the audio for you. So afterwards we'll be discussing the answer. So please ensure to find out the answer. Okay.
Read the question. Or C, extract. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a patient talking to a dental receptionist. Now read the question.
Hi, I'd like an urgent appointment, please.
Let's see, who's your usual dentist?
Mr. Garcia?
You say it's urgent. Are you in pain?
Yeah, it's the tooth Mr. Garcia filled last week.
Well, he's away today, I'm afraid, but there's a free slot this afternoon with his colleague, Mrs. Brown.
Well, that'd be okay, but are you saying Mr. Garcia could fit me in tomorrow?
That's right, we'd get you in first thing. Can you wait?
Well, I'm not chewing on that side and I'm taking paracetamol, which is helping. The pain started when I was eating a steak, so I'm frightened I might have upset Mr. Garcia's work. It makes sense for him to check it out.
OK, we'll book you in for tomorrow morning at 10.
Question 26. You hear part of a presentation to nursing staff about an extension to visiting hours. Now read the question.
Now, you'll have received the survey asking your opinion about extending visiting hours, and doubtless you've got your own ideas about the possible impact on your work. You're probably aware of the evidence pointing to the positive effects on patient recovery rates of increased contact with loved ones. This isn't in question, but of course things must be managed properly. I've heard concerns about how busy everyone is, that you've got enough on your plates without having to worry about extra demands from visitors. Well, we've carefully planned things to prevent you being overrun with queries, interruptions and so on. Visitors will be given a list of do's and don'ts outlining what's expected of them. Meanwhile, managers will be monitoring things carefully to make sure routines aren't disrupted at all.
Question 27. You hear a surgeon discussing a patient with a nurse in the recovery ward. Now read the question.
It looks like Mrs. Jones is still a bit groggy after her thyroidectomy. Will she be going up to the ward soon?
Yes, I'm going to call a porter. She should be going up in 15 minutes.
OK. I've added some extra post-op pathology orders. She may have problems with the drop in her calcium. Her thyroid was just huge. We didn't see all 4 parathyroid glands, and we need to check that they haven't been affected by the procedure. She seems OK, but I want her calcium level checked twice a day. She needs to be monitored for any breathing problems, muscle cramping and numbness, and for tingling in her fingers.
OK, I'll make sure a report to watch out for hypocalcemia is passed on.
OK, if you need me, call me.
Question 28. You hear a chiropractor briefing a colleague about a patient called Ryan. Now read the question.
Today we're going to start with Ryan. He's 2 weeks post-surgery for a torn rotator cuff. He also had a spur on his acromion process removed. This is his first time in rehab post-surgery, I believe.
That's correct.
Okay, so today we're going to begin utilizing high-frequency vibration to break up the scar tissue forming in his left shoulder joint following the surgery. We're going to do each of his treatments that way, so you'll see a progression over time, how we get him back to a point where he's able to live his normal life. Movement's the key to rehabilitation, and this treatment resonates with the nerves too, so it should eventually help them heal quicker and reduce his discomfort.
Question 29. You hear a surgeon talking to a group of medical students about patient risk in emergency surgery. Now read the question.
If you look at the risks of elective surgery, they're really very low compared to emergencies. Clearly, then, we can make the biggest difference in reducing risk and improving outcomes in emergency surgery. Our mortality outcomes here are actually below average. We're at 8% compared to around 13% nationally. The emergency patients I handle tend to be older, so they're at higher risk. And when they come in, we haven't got long to prepare them in order to reduce any risks, maybe an hour or two. In terms of patient safety, every minute, every half hour we can use to get them ready counts. That's because the patients we're thinking about are prone to developing post-operative complications, given that they have a range of associated heart, kidney, and lung problems.
Question 30. You hear a surgeon talking to a patient who's just had a knee operation. Now read the question.
How are you feeling, Mr. Shaw?
Oh, exhausted. But the painkillers must be working. I can't feel my knee as you predicted.
You're bound to feel weary after an operation. It went well, though. We cleaned out loose cartilage from the joint. You can go home now.
Oh, thanks. I had an arthroscopy on the other knee several years ago, so I know what it's like. The idea that it gets done in less than a day is still pretty mind-boggling, though.
You'll need crutches for 2 weeks, but you should be walking okay within a month.
Oh, good.
Give it 4 months before you put any serious impact on it, though.
4 months? After my last stop, I started running again within a month. Thinking about it, though, I guess I paid for it. That knee had a lot of niggles for months afterwards.
Yeah, if your body's hurting, it's telling you something.
Okay.
That is the end of Part B.
Yes, how did it go, guys? Were you able to locate the answers properly? I'm sure you might have got the same. So yes, we'll be discussing the answers now. I hope it was easy for you. Yes, so for the question number 25, the answer was A. And question number 26, the answer was B. Question number 27, it was B. And question number 28, you can expect that answer is C. 29 is A and 30 is actually B. So now let me know regarding whether you were able to get all 6 correct or did you miss? Yes, Reba, A. Did you get the answer for question number 25? So let me know whether you're able to get all 25 correct or did you miss any particular points? I hope you are able to get all 6 correct. Yes. Mega 5, good. Others, how was it? Did you miss any particular information? Five, Reba, good job. Any other people who 5? Yes, good. Most of you were able to get 5. Ensure that next time you are able to get 6 out of 6. Okay, so we can start discussing about the same. So this is the transcript of the conversation that you just listened to. So our question was 30th one. Okay, we'll discuss. Don't worry, Reba. Okay, so you hear a patient talking to the dental receptionist. How does he feel? That was our question, and the answer was worried that he may have damaged a fill-in. So here you can see the patient was yes, Gayatri, 5. Yes, good, very good. So here the patient is having a conversation with the receptionist regarding the urgent appointment, and the reception is asking regarding who is the usual dentist, and clearly stating there was Mr. Garcia. So patient actually got the tooth filled last week. Okay, so practically speaking, the person who has checked, that is Mr. Garcia, is away today, and he's afraid, and the reception is telling him, I'm afraid, but there is a free slot this afternoon with his colleague, Mrs. Brown. Okay, so he is away today because he has this slot available to meet his colleague, which means the patient can actually meet his colleague, that is Mr. Brown. Patient is telling, patient is actually requesting whether that will be okay to fit, or that will be okay whether this patient can actually meet Mr. Garcia next day. Okay, so what is this? Patient is telling, I'm not chewing on that side, I'm taking paracetamol which is helping. The pain started when I was eating a steak. So I'm frightened I might have upset Mr. Garcia's work. It makes sense for him to check it out. So patient is telling he was not chewing on that particular side where he had this tooth fill last week. He was taking the medication which was prescribed, and pain started once after the patient start eating a steak. So he's frightened that he might have upset Mr. Garcia's work. So it makes sense for him to check it out. So which means the patient is telling, rather than meeting Mr. Garcia's friend, that is Mr. Brown, it will be better if the Garcia itself is checking in what is happening, because as this was the work done by Mr. Garcia. Okay, now disappointed that he can't be seen immediately. Do you think the patient was disappointed he can't be seen immediately? No, right? See, when the patient is asked whether it is going to be okay if there is a free slot afternoon, and patient is clearly telling, well, that be okay, and he is not actually disappointed, he's actually okay with it, but still he would like to know whether it will be fine for him to have a consultation with the, what you can say, the Garcia itself. Okay, nervous about being treated by the dentist. Is he nervous in this? Do you think the patient was actually nervous here? Did you find the patient getting nervous? The patient was not nervous. What is the actual problem? How does he feel? So he is telling, I'm frightened I might have upset Mr. Garcia's work. He's not actually nervous about consulting the dentist. He's actually frightened about or nervous about whether he has actually upset Mr. Garcia's work, whether it has caused any problem with the what was the concern that he was having, whether he has upset the tooth fill, that whether he has upset that particular thing. So which is why worried that he may have damaged the fill-in. So how does he feel? He was actually worried whether it has actually damaged the same. So you ensure that you are going through this minor information to get the proper idea. I hope this is clear for you. Is it clear, guys? Yes, I hope that is clear for you. Now moving forward to the next question. So here that's a presentation which is happening over here, and it is about an existing visiting hours, and our answer was B, reassuring that their workload won't increase, right? So here what is they talking about? You'll receive the survey asking about your opinion about extending visiting hours, and doubtless you have got your own ideas about the possible impact on your work. You're probably aware of the evidence pointing to the positive effects on the patient recovery rates of increased contact with the loved ones. So must be managed properly. I've heard concern about how busy everyone is and that you've got enough on your plates without having to worry about the extra demands from the visitors. Well, we carefully plan things to prevent you being overrun with queries, interruptions, and so on. So visitors will be given a list of do's and don'ts outlining what is expected of them. Meanwhile, managers will be monitoring them carefully to make sure routines aren't disrupted at all. So our option, detailing the benefits of the plan change. What is the speaker doing? Are they detailing the benefits of the plan change? No. What are they actually detailing over here? They're actually explaining regarding how things are going to be working on, right? Explaining step they should take to avoid problems. No. are they explaining the things that they should aware on? No, they are telling visitors will be given a list of do's and don'ts, which will be outlining clear-cut idea regarding what they can expect over here. Now, reassuring them that workload won't increase. So, how do you understand the same? You can hear, see, I've heard concerns about how busy everyone is, that you've got enough on your plates without having to worry about extra demands. So which is means you've got enough on your plates, means they are having enough work now and they don't have to be worrying about any sort of extra demands that they might be getting. Okay, so the speaker is actually trying to explain regarding the the workload that they are currently having is going to be managed properly, and they don't have to be worried that their workload is not going to be increased about the same. So what is the speaker doing here? You can say the initial part, they are telling about the the nursing staff is actually telling that they might have received a survey which will be asking about their opinion about the extending visit hours, and the person is also telling evidence pointing to the positive effect on patient recovery rates, increased contact with the loved ones, things might have managed properly. Now, I've heard concern about how busy is everyone. So from here, here you can understand they are actually speaking about how evidence is pointing. That means through the survey, how the evidence is pointing towards the positive effects on the patient recovery rates, right? And how that can actually help each patient. So our question what was the speaker doing over here? Speaker was aware about these things, and speaker is letting them know that we have carefully planned things to prevent you being overrun. So again, workload, how it can be managed. So that will be managed here regarding how this is not going to add on any further work that they are having. So they are not actually detailing the benefits of the plan change. If he was detailing about the benefits of the plan change, that will be something different. Here that is not a plan change that they are adding, they're just making some or giving an idea, because the plan change is supposed to be for the nursing or the staff, that whoever is going to be here, the patient or the nursing staff is actually explaining regarding how suppose the visiting hours, as the speaker is actually explaining regarding how this is not going to make it difficult for whoever is actually managing things, and there will be this managers to be monitored things. So you should not be deviating from your question. That is what is the speaker doing. Now let's move forward with the next question. So here the surgeon is actually discussing the patient with the nurse in the recovery ward. What is surgeon concerned about? So it looks like Mr. Johns is still a bit groggy after her thyroidectomy. So the patient had a thyroidectomy. So I'm gonna call a porter. So surgeon, what a surgeon actually explained over here, I've added some extra post-OP pathology orders. He is clearly stating the patient might have problems regarding so and so information. Her thyroid was huge. We need to check that they haven't been affected by the procedure. She seems okay, but I want her calcium level checked twice a day. She needs to be monitored for any breathing problems. So basically a lot of problems you can expect, right? Incomplete results from the lab test. Are they focusing on any incomplete results from the lab test? No, that is not surgeon is concerned about. Then the patient level of consciousness. Are they focusing on any patient's level of consciousness? What are they actually focusing on? No, that is not something they're focusing on. Possible post-operative, because here you can see the patient or the doctor has clearly explained regarding the type of problems. That is, she may have problems with this drop of calcium, thyroid, and it is clearly, evidently stating they have to check regarding the procedure is, check they haven't been affected by the procedure. Okay, and see what the patient has to be monitored: breathing problems, muscle cramping, numbness, tingling sensation. So that is most probably the possible post-operative side effects they can expect for this particular patient, and they need to be monitored about the same, as these are something the surgeon is actually concerned about. Okay, now let's move forward with the next question. You hear a chiropractor briefing a colleague about a patient called Ryan. So what is the overall aim? That was the question. So here he is 2 weeks post surgery for a torn rotator cuff. He also had a spur on his acromion process removed, and this is the first time. Today we are going to begin utilizing high frequency vibration. We are going to do each of this treatment so that you will see a progression over time. How we get him back to a point where he's able to live his normal life. Movements, the key to rehabilitation, and this treatment resonates with the nerves too. So it should be eventually helping them heal quicker and reduce the discomfort. So improving pain relief. Are they actually, what is the overall aim over here? Are they actually focusing on improving the pain relief or restoring feeling in his arms? What are they actually telling? What are they trying to tell over here? You can understand that. Treating the side effects of the operation. What is the side effects that is mentioned over here? See, the patient is actually here for the post surgery for a torn rotator cuff, right? And he had a spur on his acromion process revealed. So this is it is basically rehabilitation, right? So today what they are going to begin with utilizing high frequency vibration to break up the scar tissue forming on the left shoulder following the surgery. Okay, so basically they are going to treat the side effects of an operation. So we are going to do each of his treatment. That way you will see a progression over time, how we get him back to point where he is able to live the normal life. Okay, so movements, the key to rehabilitation. Treatment resonates with the nerves too, so it should eventually help them heal quicker and reduce his discomfort. So basically the patient is having this discomfort after the surgery because of the so and so removed, and also they are going to treat any sort of side effects which the patient will be having. Remember, that's a chiropractor who is actually briefing. You can understand who is actually chiropractor is, what will be they focusing on, and how a chiropractor is differentiated from a physiotherapist. So they are not focusing on restoring feeling in his arm. Is something like that is mentioned? No. Improving pain relief. Are they focusing just on pain relief? No. He is telling it will be resonating with the nerves too, and it should eventually help them heal quicker and reduce the discomfort. The discomfort can be anything, not just pain over here. So here basically the chiropractor is briefing regarding how they are actually planning to treat the side effects of this particular operation. Okay, now question number 29. I hope you are with me so far. So here again that's a surgeon who is talking to a group of medical students about the patient risk, right? So if you look at the risk of elective surgery, they're really very low compared to emergencies. Clearly, then we can make the biggest difference in reducing risk and improving outcomes in emergency surgery. Our mortality outcomes here are actually below average. We are 8% compared to around 13% nationally. The emergency patient I handle tend to be older, so they are at higher risk. And when they come in, we haven't got long to prepare them in order to reduce any risk, maybe an hour or two. In terms of patient safety, every minute, every half an hour we can use to get them ready counts. That's because the patient we are thinking about are prone to developing post-operative complications, given that they have range of associated heart, kidney and lung problems, right? So the question was, what is actually the surgeon emphasizing, or what was the importance that the surgeon was trying to focus over here? So our options were patient at high risk require extra recovery time after the surgery. Do you think that option was here? What is actually mentioned over here? If a patient is having a higher risk, they should be getting an extra recovery time period. They're not mentioning about that, what they are trying to say. See, if you look at the risk of elective surgery, they are really very low compared to the emergency. So it is already stating they are not going to have a lot of risk associated with this surgery. And it is clearly stating our mortality outcomes are here actually below average. And again, what they are trying to say? They are also stating patients here are prone to developing post-operative complications, which is a range of associated heart, kidney and lung problems, right? Now, certain type of surgery carry more risk of patients than others. Is they mentioning that what is they mentioning? Certain type of surgery carry more risk. What are they trying to say? Here, what is actually surgeon focusing? Surgeon is actually focusing regarding the prompt preparation is the most effective way to minimize patient risk. So here they're telling, so see, when they come in, we haven't got long to prepare them in order to reduce any risk. In terms of patient safety, every minute, every half an hour we can use to get them ready counts. Why? That is because patients we are thinking about are prone to developing post-operative complications. So they might be focusing on the post-operative complications. So in order to avoid minimize any patient risk, what they can do is prompt means begin with suddenly or start. So here they is telling as soon as they come in, they have, even if they don't get any they haven't got any long time to prepare for them to reduce any risk, maybe an hour or two, but in terms of patient safety, every minute, every hour is actually counting. Okay, so initially they are looking at the risk of the elective surgery. So they are telling it is really low compared to the emergencies, and clearly then we can make the biggest difference in reducing risk and improving outcomes in the emergency surgery. And what they are trying to say, mortality outcomes, and they are giving us statistics regarding how that is actually having a difference, because 8% compared to around 13% actually. And the person, whoever is having a conversation, is stating that the emergency patient I handle tend to be older, so they are at higher risk. Here what are they telling? Certain type of surgery carry more risk. No, that is not what they are telling. Some people, not surgery that is actually making it difficult. As the patient is older, that is why the patient it is difficult, or it is a bit more riskier. So very minute words, do not confuse with the same. And in terms of patient safety, so the surgeon is emphasizing. Do you able to see any particular word that is used over here to emphasize any particular information? Are you able to see anything? Is there any particular word? What have they actually emphasized over here? See, they are clearly telling regarding patient safety. Every hour, that is because, so that is a way regarding how they are actually trying to emphasize the importance of the preparation, because with the proper preparation, or if they begin with the preparation as the earliest as possible, that will be helping them to minimize the patient risk. Okay, that is what they are explaining over here. I hope that is clear for you. Now let's move on to the last question. So here the surgeon is talking about the patient who just had a knee operation. The question was, man's comment reveals that, and the answer was impressed by how little time he spent in the hospital, right? So here you can see the surgeon is asking regarding surgeon is asking to the patient, how are you feeling? So the patient's name is Mr. Shaw over here. He's actually exhausted, but the painkillers must be working. So he's telling, even if he is exhausted, as the painkiller is working, he can't feel my knees as you predicted, which I can't feel my knee as you predicted, which means maybe because of the painkillers, the patient is not able to experience any pain. You're bound to feel weary after an operation. It went well though. So patient is telling surgeon is telling whatever the patient is experiencing presently is completely normal. One can experience after the operation. And she is also stating, or he is also taking, it went well though. So what they have done, they have cleaned out loose cartilage from the joint, and they are asking, they can go home now. You can go home now. So patient telling thanks. So patient is stating patient had this arthroscopy on the other knee several years ago, and patient is already having an idea regarding how it is going to be. So that means the idea that it gets done in less than 1 day is still pretty mind-boggling though. What does that mean? What do you mean by that? What you can expect over here? So patient is telling that I know what it is likely to be. What does that mean? Here there is a word that I've used, boggling. What is actually boggling means? You do have an idea regarding that particular word. Maybe like astonished, you can say he is still not to be able to, extremely surprising or difficult to understand or imagine. That is the meaning of that particular word. And what was the question? Man's comment reveal that. So here patient is telling, even though the patient had this arthroscopy like few years ago, still he is not able to get the idea regarding how it is done in less than 1 day. So he is not still able to understand how it is going to be done in one day, and he's pretty much surprised or astonished because of the same. Okay, and now surgeon is telling regarding the patient might require the crutches, but you should be walking okay within a month, and within 4 months before you put any serious impact on it. Okay, now 4 months. So after my last stop, that means I started running again within a month. Thinking, which means before, as he just mentioned earlier, that he had a surgery before. He's telling after the last surgery, he started running within a month. Thinking about it, I guess I paid for it. Maybe that is why the knee had a lot of niggles for months afterwards. So if your body is hurting, it is telling you something. So the surgeon is telling if your body is hurting, which means there is some problem. So man's come and reveal that determined to start doing sport as quickly as possible. No, you can't come up with that option, because patient is already having an idea that just because the patient had gone for running after this previous surgery, he did experience a lot of problems afterwards. So he is not actually determined over here. So first option is not there. Now, surprised that he will be relatively pain-free so soon. Is he surprised about getting a pain relief so soon? What is actually mentioned? What is actually mentioned? He is not actually surprised that pain is going to be relieved so soon. He is actually surprised that it is going to be done in less than a day. That is what he is surprised, impressed by how little time he spent in the hospital. So the man's comment is revealing that the patient is able to get it done within a day, and that is quite surprising over here. So that is boggling. The word boggling is here. He is quite impressed, or he is quite astonished, or extremely surprised. It is not just surprised. He's extremely surprised, and patient is still experiencing, he'll be relatively pain-free soon. What is he telling, that the patient is not going to get any pain relief as soon as possible? No. So painkillers must be working. I can't feel my knee as you predicted. So it is working, but not completely pain relief. So that is something he is actually, what to say, surprised about, regarding how little time he has to spend in the hospital. So that is something pretty mind-boggling. So you have any questions about what we discussed so far? Yes, Clarina. Any question? I hope it was clear for you. So for part B, as I've mentioned earlier, go through different type of documentaries which do have the conversations, so that you can get used to the accents, and you are actually able to follow the pace that the patient is or the conversation which is happening. That will be helping you so far, because as it's conversation that is happening so far, which is like pre-recorded and stuff, it will be helping you if you get used to the accents and the natural accent, I would say, so that you can get used to it and read your questions thoroughly. Your gist, STEM, it will be helping you. Any questions? Please do mention if you have any questions in your comments. Okay, I hope it was clear for you. So we'll be meeting next week. Till then, good night, guys. Have a good day.